Hi, everybody. Welcome to today's Hinckley Forum. My name is Julia. The Hinckley Institute of Politics is a nonpartisan institute at the University of Utah. The Hinckley provides an array of transformative experiences for students through internships, forums, and classes. Hinckley forums seek to foster public discourse and civil debate on the most current and pressing issues, bringing in local, national, and international thought leaders. We want to thank the Department of Economics and Women and Economics Club for partnering with us on this event. Today's forum is titled A Woman's Worth, the Inequities of Utah's Workforce, and we are excited to be joined by some great panelists. Today's conversation is moderated by Professor Sarah Small from the University of Utah's Department of Economics. I will now turn it over to her.
Hi, everyone. Thank you so much, Julia, and thank you so much to the Hinckley Institute and to the Women in Economics Club and Department of Economics for getting us all together for this exciting forum. So as Julia mentioned, I'm Sarah Small. I'm a faculty in the Department of Economics here at the University of Utah. I'll just take a minute to introduce our four wonderful panelists, and we're so grateful that they're here. I'll start with Siriac Alvarez Valle. She currently works as a senior policy analyst at Voices for Utah Children. Her work is primarily focused on children's health coverage and policies that impact immigrant families. She combines her personal and professional experience to build bridges in policy and advocacy by building up the capacity of community leaders and bringing people together to shift policies to ensure all kids have the opportunities to thrive. Next, we have Dr. Ariel Roddy. She's a Sault Ste. Marie Ojibwe woman and an assistant professor in the Department of Sociology. Her research focuses on the economic marginalization of individuals with a criminal history, with particular attention to intersectional concerns in reentry and substance use recovery. Next, we have Yazga Genk, who's a PhD student in the Department of Economics at the University of Utah. She's working on issues about the U.S. childcare system. In her role as a research fellow at the Economic Evaluation Unit, she partnered with the Utah Department of Workforce Services and Office of Childcare to evaluate access to and affordability of childcare services across our state. And lastly, we have the wonderful Anna Thomas, who's the policy director at Voices for Utah Children. She's originally from Utah, and she holds an undergraduate degree from the University of Denver and a graduate degree from the University of Utah. Prior to joining the Voices for Utah Children team, she spent 10 years working for the ACLU of Utah. So those are our wonderful four panelists that we have here today. And as Julia mentioned, the topic of our panel is on women in work in our state. I'll just open with a few kind of broad remarks, and then we'll turn to our panelists for the first 20 minutes or so, 25 minutes or so to talk about what's contributing to these gender gaps in our state and in our economy. Then after that, we're going to focus on some policy solutions and ways that we might look ahead, right, for Utah and gender equality. So generally, right, I think there's a lot of comments about how Utah has a relatively strong economy, right, compared to several other states in the US. We're doing quite well in many regards, but Utah is unfortunately almost always ranked as one of the worst states in terms of gender equality in the economy. Utah has one of the widest gender pay gaps in the country. Women who are working full-time and year-round earn about 73 cents for every dollar that a man also working full-time and year-round makes. Only two other states, Wyoming and Louisiana, have wider gender pay gaps. Utah also has a relatively low women's labor force participation rate. So among non-institutionalized working age women, about 60% were in the labor force in 2022. So with all of this kind of going on, I'd like to open it up to our panelists and ask kind of what's contributing to these gender disparities in Utah, and what barriers exist for women kind of entering the workforce and doing well in the paid workforce. So I'll start with Yazga.
Thank you. Thank you for organizing this panel. I'm really happy to be here. I want to thank the Women in Economics Club, the Department of Economics, and Hinckley Institute for hosting this this forum with this amazing people. So I can start with the gender wage gap. So the gender wage gap that Sarah mentioned, like at 73 cents, actually means like we have a wage distribution for women, wage distribution for men, and we're comparing the median wages for these two groups, and then mostly all the wage gap comments in a broad sense are making by just checking those two numbers. So there are a lot to unpack here to understand like what those numbers means and what contributes to see those different numbers for different subsamples. Like the one way of understanding this, like economists can approach this problem by checking some observable characteristics that can contribute to these wage disparities, like education. Like, does do women have lower education levels than men? Like that can contribute to this current wage disparities. Occupational segregation is like another way to unpack this wage disparities. The experiences, like years of experiences that these people are having, are another way to think about why we are having these wage gap in the state. So these are all contribute to the story. None of them can give us the full picture of the gender wage gap, but each of them have their own components to understand gender wage gap. So when we control these characteristics, these observable characteristics for these two different samples for women and men, we can understand some of the concepts, some of the parts of the wage disparities in the state. But like I said, that doesn't give us the full pictures. There's still some parts, some aspects that we can control, but that can contribute to the wage disparities. For the education part, for instance, so women in Utah today are highly educated than ever. So like 33% of the women in Utah are having a bachelor's degree. That's just left behind the US averages. For the US, it's like 34% of women are college degrees. So it seems like education is not a huge problem in the state to understand these wage disparities, but among bachelor graduated people, when we see the wage disparities among them, we even see the wage gaps between those people. So clearly education cannot help us a lot to understand. And then the second, like I mentioned, the occupational segregation, women are mostly concentrated in lower paying industry in the state. Like they are mostly an educator or healthcare services, childcare services. So these are the lower paying jobs. So that's why like their median wages are lower than the men. Men are more dominated in higher paying tech industries. And then lastly, like an experience, it's not surprising when women are having less experience in the labor market because they are more likely to drop out from the labor market because of the family responsibilities. Like imagine like you're working as a woman with your male colleague in a workplace. Once you start having kids, you might need to drop out to the labor force. But during that time, like whatever years that you're taking a leave in absence, your male colleague continue to promote, continue to increase its wages. But when you come back to the workplace, you kind of start where you left. So that also contributes to the lower wages that we see in the market for women in Utah. So these are all like effects that can help us to understand the wage disparities. But more importantly, I guess, I think we need to focus on what makes women lower experience, like lack of childcare facilities, what makes women to push lower paying jobs, because lower paying jobs like care industry or education, they are offering more flexibilities to women and they are kind of pushed to choose those career paths. So like a root causes that can help us to understand the wage disparities in the state is more important right now. Otherwise, we are highly educated women in the state, so there's no problem for having a highly skilled woman in that sense, but we're still seeing a lot of people in the lower paying industries. And also like another question, why women concentrated industries are lower paid jobs compared to other ones. So there's a lot to unpack, but in general, so these are the way to approach to current wage disparities. I think I'll stop here.
Yeah, that's great. Thank you so much, Yaska. That was really helpful to give us some overview. And I know part of your expertise is in childcare markets, but as is Anna's. So Anna, maybe do you want to chime in and tell us kind of your perspectives on childcare and how that plays a story in this in some of these statistics?
Yeah, I mean, I think that childcare as an issue and as an industry is a great place to look at all of the institutional and historical sexism that plays out in our society, particularly for women of color, but for women more broadly. We in Utah have the same historical and traditional sexist culture that the rest of the United States has struggled with. But we actually don't have any proactive state policies in place that supports women's equal participation in the workforce. Childcare support is a major part of that. That's an issue that's been largely ignored by state leaders up until a few years ago. And I'm not sure that the pink recession has been interpreted as actually a problem by economists and state leaders. There are other things in addition to childcare support, like pay transparency, paid family leave. I like that Yazga said family obligations, not just children, right? Women do a lot of caretaking roles within their family network. So paid family leave is something that we haven't really explored much as a state in terms of a policy to support women getting in and staying in and coming back into the workforce without the penalties that Yazga spoke about. I would also point out, and this may be something that Syriac can expound on, but we have a fairly substantial refugee and immigrant population in Utah. And aside from the welcoming resettlement profile of Utah, we really don't offer the long-term support that these families, particularly women who are trying to head many of these households, they need in order to really establish themselves. So a good example is, refugee women are often interested in starting their own childcare businesses and offering culturally competent childcare to their, fellow refugees from similar ethnic and cultural backgrounds. However, they're most likely to live in rental properties. And Utah is a state where landlords don't really have to do anything that they don't want to do or see in their business interest. So mostly they're not able to start home businesses where they can offer childcare in a way that makes sense for them as entrepreneurs. I think childcare encapsulates a lot of these issues. It's just, if as a state, our leaders actually saw the low status of women as a problem, we could possibly adopt policies to address that. But I don't see much investment around the childcare issue or around some of these other issues that state leaders predominantly don't think this is a problem that needs to be dealt with in terms of social impacts and economic impacts and, career and educational impacts for women. So yeah, I don't think there's a lot of political will that we've seen to do anything about addressing some of those root causes that Yazga mentioned.
Yeah, I think that's right, Anna. Thank you. And thank you for all that information. I would love to come back, and we will come back to hear more about maybe some policies that we could try to implement, or at least consider implementing given any sort of political momentum. But Syriac, I'd like to turn to you and hear kind of what you think about all of this. And I know a lot of your expertise is in health coverage and policies that affect immigrant families. So I'd love to kind of hear how those facets might contribute to gender economic equality or inequality in our state.
Yeah, thank you, Sarah. And I agree with some of the comments made earlier, just about the importance of looking at the childcare sector and just the different, or I guess unique, challenges that are faced by refugee and immigrant women. I think a lot of people may be surprised, but we do have like 9% of like immigrants who are born like foreign born, and then about another 9% who have like who are native born US citizens with at least an immigrant parent. And so we do have a lot of immigrants in our state, and unfortunately our policies don't necessarily like reflect that. And so, for example, when we look at like some of the disparities, they're worse off sometimes for immigrant women or just immigrants in general. So, for example, when Yazga was sharing about educational levels for immigrants, it's not always the same. So there's a higher share of immigrants who have less than high school diploma. And while, right, like education attainments can only like get us to a certain point, not having those educational attainments makes it so, you know, people or some of these immigrants or refugee women will not even be able to get some of these like opportunities that maybe some other women who are born in the US would be able to. When you look at like the sectors that our people are working in, they often are like service-based or forest-based. And while a lot of like immigrant men are in construction, we do see that like a lot of immigrant women are in like childcare sectors or domestic work, the care jobs or housekeeping, and those kind of positions don't often have a lot of the same what is it called, like pay, right, like equal pay. Like we don't look at those jobs in the same way that we look at a tech job or even an office job, and even having the same kind of like opportunities outside of just pay, like healthcare or sick leave or all of these like other opportunities to be able to have like you know, like a day off and not have that like be detrimental to your family. I think those are also really important things to look at. And so when I think about these policies for immigrants, I think first in like a just immigration system, right? Like what we can do to ensure that people have equal access to just equal protections when it comes to jobs, and then looking at specific sectors, just what we can look at to ensure that these women who are in these really important jobs would be able to have better protections for their work.
Yeah. That's great. Thank you so much. And I think you highlighted so many really important things there, right? Occupational segregation, right? But also I think something I'm so happy you brought up is, it's important not to, when we open with some of these statistics about labor force participation and gender wage gaps, right? It's easy to kind of lump women into this kind of monolith, right? And assume they all have the same types of experiences, but we don't, right? And I think Utah especially is a very diverse place with lots of different types of experiences for women in the economy. Right. You also, I think, really talked a lot about, the unique experiences that some immigrant women are facing. And I'd like to kind of turn to Dr. Roddy now and hear kind of about, her expertise in, marginalization of individuals with a criminal history. And I think I would imagine, and you'll tell us, but I would imagine a lot of those women are facing kind of similar economic barriers that we've talked about here. But what are some of the kind of unique challenges?
Oh yeah, absolutely. I think that this has been, I don't know who picked the order of who was meant to speak, but it feels like this is a great transition kind of into women with justice involvement in particular. So I'll just give a brief background for those of you who are maybe unfamiliar with the scope of women's incarceration and women's correctional supervision kind of in Utah. So largely what we've seen is across the state, the number of people under correctional supervision has decreased, certainly since COVID, of course, has increased largely since the 1980s, right? So since we've kind of established this war on drugs, we've seen nationally that individuals under correctional supervision has kind of increased, and then slowly, certainly since the pandemic started, has decreased largely. But in Utah, and for women in particular, women's correctional supervision has really increased over time and has even increased since the pandemic has started. So some of the figures that I've picked out, so women make up almost 1 out of every 4 jail admissions, which is pretty stark. And then also, so since men's jail admissions have declined by 26% since 2008, women's admissions to jails have increased, right? And so I'm going to talk about jails kind of specifically because that's the population of women that I've worked with historically. And women who enter jails are more likely to have some sort of substance use disorder, which certainly affects your ability to find and maintain work, right? And the treatment atmosphere in Utah is particularly bad, I think, relative to other places that I've worked. It seems like there is a lack of access to treatment resources, and in particular, gender responsive treatment resources. So this is definitely going to be to the disadvantage of women who have some sort of jail involvement in their past, right? So that's, I think, a particular barrier that specifically I have experience researching, and it's something that's certainly predominant here. But even outside of jail context, so in more long-term carceral settings like prisons, so there's one female facility for women in Utah, and it has around an occupancy of 500 individuals at a time. And one of the larger issues that's being acknowledged and talked about kind of at the state level is the lack of employment programming for women in that particular facility. So men have access to classes in automotive technology. They have classes related to like computer and technological services, as well as welding and more, what do I want to say, more like blue collar work, right? But when we start to think about the access to programming that women have in that facility, it's related to culinary arts, more pink collar jobs of that kind of nature, right? And especially when we start to think about the way that certain workforces are expanding, certain markets are expanding, women's employment, you start to see that the areas in which women are primarily situated in, and the ones that are most accessible for women with a criminal record end up being very difficult to access for women that are leaving carceral settings. So that ends up contributing and exacerbating, I think, the problem that we're talking about today. I think also I would be remiss if I didn't talk a little bit about abortion and the criminality of abortion in Utah, right? I think we're going to start seeing these issues kind of exacerbated over time, given this lack of access to abortion care, right? For those of you who are unfamiliar, abortions are banned following 18 weeks of gestation. They're not going to allow abortion care services to be provided in those contexts. And it is a felony offense in Utah, although it's unclear necessarily if women who are receiving these abortions will be prosecuted to the full extent of the law. What we are seeing in adjacent states, right, in the Idaho House bill, I forget what bill number it is, I haven't written down yet, 242. So this bill in particular makes abortion trafficking a felony punishable offense, right? So individuals who are looking for abortion services outside of the state, if they have state residency, legal action can be pursued against that person. And especially if that person is minor, the fact that you're trafficking this individual underage can have huge ramifications for parents too, right? So I think that there's kind of this very unique context specifically related to the criminal justice system and women who are looking for work that are going to, I think, kind of you're going to see kind of worsening effects over time. And I think that kind of creates this larger problem that needs to be addressed.
Wow, thank you so much, Dr. Roddy. That was really helpful. And I'm thankful you brought up this issue of abortion. I know it's on a lot of folks' mind in our state as we're moving forward here. So maybe this is kind of the point where we can start to think about turning to some broader kind of policy implications, right? I think I've heard all of our panelists talk about kind of issues of state level support, right? Occupational segregation, issues of discrimination, right? And all of these types of issues that I think we could ideally, right, see some state support around. So maybe we could start with Syriac, if that's okay with you, and hear kind of what are some policy prescriptions we might recommend to start to close some of these gender disparities in our state. And, if you have any kind of policies off the top of your head from other states that you have seen and would like to see replicated here in Utah, I think we'd love to talk about them.
Yeah, I mean, I think there's a lot that we could be doing, but when I think about policies, I do think that it's really important to consider just how we can be more inclusive when we do enact a policy, whether that's for immigrants, right? Or whether it's people who are in the justice system, and really think through some of the pieces of like where we could allow more people to benefit. Anna mentioned at the beginning, right, that childcare workers who are refugee women may not be able to access some of these services. So how can we not only, right, like allow refugee women to be able to be childcare providers, but how can we also create like opportunities for like learning or cultural or language, right, like inclusive training, so that they can actually access these things. When I think about some of the healthcare policies, I do hope that we consider more opportunities for, like I mentioned earlier, domestic workers, people who don't have those traditional jobs, to be able to have the same opportunities, so that when they do get sick, it doesn't like everything doesn't fall right like down because they got COVID, for example, or because their child is sick and they have to take them to the doctor, and then they don't have work for a few days, things like that. And then there are, I think, just generally, because I work on healthcare coverage, I think it's really important for families, and making sure that more kids in our state and more parents have the healthcare coverage that they need. We have one of the highest rates of uninsured kids in the country, and when kids get sick, most of the time, right, like it's moms who end up having to take care of the kids and taking that time off. And so if we have coverage and kids can get the care that they need, whether it's in clinics and preventative care, then they don't have to fall back on emergency rooms or just those emergent cases. And the last thing I would just mention is that there is, I think more broadly speaking, we do have to really think about how we are going to move forward with our immigration system. I think it's long past due. Just a resolution for immigrants in general, whether that's like people who are undocumented, like the 11 million or more than like 90,000 here in Utah who are undocumented, but also just their families or kids, and just how it affects mixed status families. During COVID, we saw a lot of like disparities for immigrants, where they were left out of systems or left out of the stimulus checks because they didn't have status. And that doesn't just affect the one person who's undocumented, but that affects the whole family. And so I think just more broadly thinking about how we can actually move forward with an immigration system, both for people who are in the US, and then people who are out in the US for families wanting to bring in, right, like other refugee like family members, and how we can ensure that people can get a pathway to citizenship, so that they can have access to some of these opportunities, whether it's healthcare or whether it's just better working conditions, or the ability to ask for better pay, things like that.
Yeah, that's great. Thank you. And I am especially appreciative that you brought up this point about lots of undocumented folks being left out of COVID relief policies, right? I think there's been a lot of conversation, I guess, around issues of women and work about the pandemic, right? And about folks maybe leaving the workforce because of the pandemic. But thank you for bringing some more additional nuance to this. But Anna, yeah, what do you have things you'd like to kind of add on to this? That'd be great.
Yeah, I really appreciate Syriac bringing attention back to that issue, because I think sometimes we don't acknowledge, like the way Dr. Roddy mentioned that laws impacting reproductive freedom necessarily impact women. It's unavoidable. And laws that are actively hostile to immigrant families negatively impact women. These things do drive gender inequity in our state. They're not ancillary or extra or add-on. They're part of the problem. For example, I wanted to mention, again, federal immigration reform is way, way overdue. And also, Utah has many, many policies that are, as I said, actively hostile toward the success and the integration of particularly undocumented immigrant families that we could do away with. So when Utah followed the lead of other states back around 2010 and started adopting very aggressive anti-immigrant legislation, we saw a change in business licensing statute in Utah that made it impossible for undocumented people, it's going to be primarily women, to be licensed as childcare providers. We lost hundreds of licensed childcare spots across the state, not to mention the proportion of culturally competent and like community comfortable care that was available to people, and then just had to either go away or go underground. And then those providers no longer had access to professional development opportunities, or, as Cyriac mentioned, relief that came to the childcare sector through COVID relief. So it's really substantial to consider that. And I appreciate her bringing that up. So I think there are things that we could stop doing that would really help move forward, even without enacting any new policies. I did want to mention, you both discussed briefly who was in and who was out of childcare relief. COVID relief. The childcare sector all across the nation was a big focus of federal relief for obvious reasons. It was so much harder for people to offer childcare with all the different protocols as we were figuring out what needed to be done with regards to the pandemic. But also, parents were staying home with their kids and they weren't enrolling them in childcare anymore. And that can easily cause a childcare business to collapse without support. So we saw hundreds of millions of dollars come into Utah to support the childcare sector. And this is in a state where historically our state has put in the absolute bare minimum of state investment to draw down federal dollars for example, childcare subsidies that we offer. So we actually saw growth in our childcare sector over the course of COVID, over the last 2 years. We have more licensed childcare spots, we have more licensed providers, and this is actively connected to the programs that the Office of Child Care and others implemented using federal funding, startup grants, all sorts of physical facility grants, and then stabilization grants that really, I would say, take the place of the investment we always should have been making in childcare because it is constantly in market failure, and we don't often acknowledge that in our policies in this state. So, it would be very easy for the state of Utah to simply continue the policies that were enacted during COVID that made things substantially better in the childcare sector. That would cost hundreds of millions of dollars. And as we saw from the recent legislative session, we didn't see any political will to substitute any of that federal funding with state funding, even though these programs are working very, very well. So we've already piloted them. They're right there. And for anyone who wasn't aware, before COVID, Utah was one of the worst states, maybe the worst state for childcare accessibility. 77% of Utahns live in a childcare desert. That is really bad. So to make any progress over the course of a pandemic is outstanding. So again, very simple, continue those policies. But that is not something that we've invested in. And I wanted to say too, other states have done things that they're not really pioneering, they're not reforming the whole childcare sector, but they are making a difference. A substantial child tax credit at the state level. We passed a tiny, tiny one for a limited band of families in this last legislative session, but any support that can go to families to offset the cost of childcare has a substantial impact on women's ability to participate, not just in the workforce, but in their communities more broadly. And then, state paid leave. The state government is one of the biggest employers in the state. We have a lot of municipal employers at the county and city level. 6 weeks is better than no weeks, but I haven't had my own baby, but from what I've heard from others, that does not feel like a lot of paid leave. These things all cost money. And I think this is the wall we continually run into in our state is state leaders who manage the pocketbook of the state have little to no evident interest in investing in any of these policy solutions that we know could move the needle for women and families. And until that changes, I don't see a lot of those things changes, even though we have policies out there that we could adopt from other states that look pretty simple and can have a substantial impact on women.
Yeah, that's great. Thank you, Anna. That was really compelling. Yazga, I know you're doing some work in a similar realm, right, on childcare supply and how that might affect women's kind of labor market success. Did you have any kind of policy prescriptions that you were hoping to add to the conversation?
Yeah, not many actually. They describe very well, but I just want to kind of point out that there's no way that the Utah childcare market can survive without enormous amount of public funding, so like the government funding. So because these childcare providers are not like greedy capitalists that can focus on maximizing their profits, decreasing their costs and everything. So their biggest cost is labor. So and then childcare workers are already working in which really low wages. So there's no way to cut costs anymore because they have to have decent working condition. But right now they don't have it. So there's no way that I don't see any way that we can see cheaper childcare options with private providers. So like Anna mentioned, we need to have excessive amount of government funding to make this market work.
Thank you, Yazga. And I think it's also so important when we think about childcare, not just think about supply, but also the workers, right, who are primarily women. And to make sure that they have, a living wage, right? And this is something, that Dr. Roddy kind of touched on in her discussion of women's reentry, right? And kind of being trained in some of these pink collar occupations. Dr. Roddy, I'd love to hear kind of what you think about some of these policies and how they might interact with women who have a criminal history and supporting their kind of economic well-being.
Yeah, absolutely. So I think all of these points are really well made. And then to go back to Siriak's point that we want to make sure that we're able to make the program prescriptions, the policy prescriptions that we're suggesting equally accessible, right? So especially thinking about immigrant individuals and justice involved individuals, right? I was talking to a number of women during COVID who had great difficulty, I think, accessing the same type of relief checks that we were describing, right? That especially due to moving their primary residences, if they were unable to file taxes in the previous year, all of these things kind of interfered with their ability to receive those really important funds. And then in addition to this, right, also when we're thinking about childcare, which is a very prescient need for individuals who are reentering from carceral settings, we also know that especially individuals who have felony offenses on their record, felony offenses related to drug use, even they're unqualified to work in childcare sectors, right? So especially when we do start to think about kind of the issues related to a supply of workers who can provide childcare, that's a segment of the population that are disqualified to do so just because of a felony drug offense, right? And even if they're in treatment for 7 years, have experienced no relapses, that's still something that is seen on background checks in Utah. So that's something that I think we could start to think more critically about as we think about access to childcare and how to better inform the supply side of this intervention. In addition to this, there are also ways in which felony offenses can interfere with the receipt of other benefits. So I don't think Utah, this is true for TAMF or for SNAP, which is great. It's one of the few states that does not have these types of bars to receiving those, which is excellent. However, there is oftentimes drug tests associated with the receipt of TAMF, which is, of course, a systematic problem for women in the justice system. They are disproportionately substance involved, which then makes it exceptionally difficult for them to be able to provide for their families and have the resources that they need in order to look for work, because that's kind of a costly procedure in and of itself, right? And then thinking too a little bit about these types of programmings that we could offer in women's facilities, right? If we have the resources to do it in men's facilities, it does very difficult to make the argument, to me at least, that that's not something that we could also provide to women as well, and to start to rethink the way that we think about employment for women leaving carceral settings, because we see the landscape of labor just changing so drastically. And I think there are plenty of opportunities to be able to do that more effectively for women returning from long-term carceral facilities. So those are kind of the major issues that I saw as a part of this conversation that we're having right now.
It's great. Thank you. This is really wonderful. Thank you all so much. I think, we've touched on a lot of issues that might make us feel maybe like optimistic or pessimistic about the future of women in work in Utah, right? We've touched on, the criminalization of abortion, the, recent, improvements in childcare, but also lack of support in the childcare market. We could think, also about, as you just kind of talked about, right, changes in kind of the labor landscape, right? There's lots of things going on in our macroeconomy, lots of changes in the types of work people are doing, lots of changes in where they're doing their work, right? Work from home or not. So I guess I'd kind of like to, take maybe the last, 8 or so minutes before we open up to questions, to hear from each of our panelists their opinions about, whether we think kind of economic gender equality in Utah is going to be kind of better or worse in the next 5 years. You can be as pessimistic or as optimistic as you want. And again, feel free to kind of reiterate any policy solutions that maybe we've missed. So maybe Dr. Roddy, we can start with you.
I'll unmute myself. So I think there are unfortunately plenty of reasons to be pessimistic, right? For all of the reasons that we've kind of outlined. It doesn't feel like we have strong political will to get something done in this area. I don't necessarily just want to leave us on an incredibly negative note, because in general, that's just not how I like to end a conversation. So I do think that there are some opportunities that are being presented to women with historically maybe, disqualifiable offenses for different types of work. So during the pandemic, the very, very early stages of the pandemic, I had interviews with women. This is technically in Michigan, but I think it applies kind of more broadly to the greater macroeconomy, talking with them about their experiences trying to find work. And while a number of women, of course, reiterated the concerns that we have, especially women that were childless and women that were kind of in the later stages of their recovery, talked about kind of how the early stages of the pandemic lend themselves well to women who are looking for work during a time where it felt like there was kind of this the supply side issue of workers. So women that I talked to were able to work at jobs that they had applied to years ago, where they weren't able to receive an interview, and now suddenly it felt like they were receiving more interviews than ever. And a part of that was because of this really high demand for I hate to use the word low skill, but occupations with low barriers to entry, right? So there were instances where I was able to speak to women with a criminal history that would normally kind of force them to be discriminated against. We're receiving new opportunities and more interesting opportunities to them kind of as a result of these like huge shifts in labor market demand. So even though I do think there are plenty of reasons to be discouraged, I do think that especially for women who traditionally have been kind of left out of these larger conversations are suddenly kind of being looked at as more appealing. So I think there are reasons to feel more optimistic, especially for justice-involved populations, as things start to shift kind of more in a labor demand kind of direction. However, I do think, I mean, especially thinking about abortion and abortion criminalization, and also this childcare desert that we find ourselves in. Those are clearly things that need to be addressed before we can really start to see large shifts in inequity. But I think kind of at this micro level, when we talk to specific individuals, some of them are kind of experiencing new instances of freedom, or at least opportunity to be considered in certain dimensions. So that may be uplifting in some capacity, I hope.
Yeah, thank you. I think it is. Yazga, what are your thoughts kind of in the next 5 years? Do we have reason for any optimism?
I don't know. I'm kind of optimistic because whenever I talk to my students, like they're asking extremely challenging questions regarding gender equality in the state. So it gives me a lot of hope. So I was like, I really don't know. I mean, let's talk about it. Like, let's discuss it. So and then those people will be in the market soon. So like with all bachelor's degrees, women will be in the market. So I'm hoping that they will continue asking challenging questions in the places that they will have. So that gives me a very optimistic point of view. But at the same time, I know, like as a social scientist, I know that the social norms plays a huge role to understand the current inequalities that we're experiencing, and I don't believe that we will see any change regarding the norms. So there will be quite. I don't believe that I will see any changing norms in the state or in this patriarchal world in general. But at the same time, I'm optimistic that we can create policies that kind of eliminate the effect of social norms, so that kind of rule out them out of the equation. So yeah, I have kind of mixed feelings. I'm not sure.
Well, thank you. And Anna, I think, you've talked a little bit about lack of political will. What's kind of your takeaway or your sense here looking forward?
I think you can guess. I think just practically, logically, if you look at whether we have put any policies into place currently or recently that we expect to come to fruition in 5 years, like what's going to change? We haven't grappled with these things. I think there's an unfortunate habit in Utah, probably everywhere, of magical thinking. There's going to be something that intervenes to turn things around, and we don't know what it is, but it will happen without us actively doing anything. So I guess there may be some dramatic, unanticipated change that would shake things up. But what is bigger than a worldwide pandemic? In Utah, we have gotten to the point where we can talk about childcare with state policymakers, where 4 or 5 years ago, that wouldn't happen. But that's a tiny leap for how big of an impact the pandemic had on families with young children. So I think, just realistically, if nothing changes, and nothing changes dramatically, then why would we expect things to be any different? I regularly look at the research that Dr. Susan Madsen and her colleagues make available year after year after year about women's status in Utah. No surprises. There are no surprises anymore. I think the only thing that makes me optimistic is that, like what Yazga said about, younger people asking challenging questions, I think that unless particularly women who are in these situations of struggling to find childcare, struggling with paid family leave, struggling with finances, struggling with access to education and all these other things, they have to get mad in a way that makes other people uncomfortable. And I think we have to ask for things that make a difference that make people very uncomfortable. I was raised in Utah. I am ethnically passive aggressive. I understand how difficult it is, but if we sit around looking for policy solutions that are easy, very inexpensive, and that everybody is happy with, nothing will change. Nothing will change. And so I think there is that reality of needing a cultural shift, not just around how women are seen in society and their place, the type of labor they do, such as caregiving, which is critical but unrecognized, but that we have to change those cultural approaches to problem solving in Utah, where we want to shy away from anything that seems hard or that some group is upset with. If you really want to see change, I think you have to make a commitment, be realistic about what policies you're going to implement to get there, how you're going to know you got there, and be comfortable with a very, I don't know, difficult to manage change. Otherwise, maybe in 50 years, it will be better, but definitely not in 5 years.
Yeah, thank you so much, Anna. And thank you for that call to action. I think we'll then kind of conclude with Syriac and your thoughts on kind of the future of gender equality in Utah. And then afterwards, we'll open the floor to questions. And so if folks have questions, please feel free to start kind of writing them in the chat, and we'll get to them after we hear Syriac's thoughts here.
Yeah, I don't think I could have said it any better than Anna. The only thing that I would add is that I hope it's not 50 years. I hope it's a lot sooner. But
well, you'll still be alive, Syriac. I won't. So I hope it's a lot faster.
I would say, though, that what does keep me optimistic, other than really hoping that in my lifetime and my adulthood, I will be able to see a women's worth actually be recognized, is that there is roadmaps, there are policies, there are other places that are doing these things. And so it's not like we're working from scratch, or there's no way that this might even be possible, right? Where we can invest millions of dollars into the childcare sector because we need it, because there are other states who are doing it, and there are other states who are starting to really shift their perspective or view on types of work or inclusivity of policies. And so I think that does keep me hopeful that at least in the next 5 years, we can start shifting these conversations to really think through the kind of policies that Anna is saying that, may be uncomfortable for some people or may not be easily done within one legislative year or one legislative cycle.
Thank you so much. Great. So Yaska, I'm sorry, I see your hand up. Like I said, if anyone else has questions, you can use the raise hand function. But Yaska, go ahead.
Yeah, I just want to add one quick thing that Anna's point during COVID. So COVID was a big event for me, big issue for me to rock my priors about the women in state. So I used to believe that their attachment to the labor force is not that strong. But when I was reading that, the Susan Madsen's and colleagues in-depth interviews with the women in Utah during COVID, so it's so obvious that dropping out the labor force is kind of the last resort for them. So they do everything to stay in the market, but the challenges, the conditions are so challenging. So it kind of, they have nothing to do about dropping out the labor force because there is no institutional support, there's no federal support, there's no government support to keep them in the market. So yeah, I just want to highlight that. I think the women in the state's attachment to the labor force is kind of higher than our observations, our expectations. So.
Great. Thank you so much, Yaska. That's helpful. Great. So I think it's time to move. We have a little bit of time for maybe one or two questions. I see Sheena's hand up. Sheena, maybe you could unmute.
Oh, here we go. Can you hear me now?
Yeah.
Perfect. Thanks. Thank you to all the panelists. Really, really interesting discussion. I have like 3 points. I'll get questions and get to them quite quickly. The first one, I just wanted to highlight for Syriac and Ariel, the intersection of your guys' work. There was this recent paper that came out that looked at the ACA expansion in across the US and kind of seeing what happens to police arrests and how that significantly declines once people have access to healthcare, because often jails become sort of this front line of mental health care and substance abuse needs. So I was just going to highlight that there's like a deep intersection there, and why, you know, the work you do, CUREC, is very important, even into the justice system. And then the second thing I was going to say for Anna, hi Anna, nice to see you again. I know we've sat in many sort of juvenile justice related meetings, and sort of these policy discussions on care don't necessarily come up, but something interesting I discovered this summer was, especially related to the refugee population and sort of this disparity of racial and ethnic minority youth, particularly the refugee population youth, being more involved in the justice system. And now they're kind of having these conversations about, well, often these are single parent families. And so how do we deal with sort of the childcare deserts there, in addition to they're often sort of segregated in these neighborhoods that don't have the same recreational, even transportation access. So I was just going to say, like, I feel like there's a subversive way through that sort of issue of, well, it's called like gang violence reduction. But it's a way to sort of subversively introduce like why care is very important if we really do want to address sort of, you know, juvenile justice related issues. So there's that. And then the third thing is a question for Ariel. You know, in your experience working with not only women in Utah, but you know, I'm assuming a lot of these women are mothers themselves. And have you seen sort of, you know, what happens? There's clearly a childcare neglect if one parent in the family is gone, and does that now create sort of this intergenerational cycle of now, you know, there's, you know, neglect, or they become dual involved youth because now they're under the foster care system, or, you know, what are sort of the issues you've seen there?
Excellent question, Sheena, and thank you for the reference to that paper. I'm excited to read it. So certainly, I think you're kind of already, you're hinting kind of at the larger problems and the intergenerational effects of, justice involvement on young individuals. So what I've seen happen fairly regularly, especially for women who are under some sort of institutional correctional control, right, is that they end up having family members, and most likely it's their mother caring for children in their absence. Sometimes there can be other intimate partners that are able to, but largely you see kind of the raising of the child kind of within the individual's kind of direct family. And especially for women with substance use disorder, there end up being kind of these like issues of trust that kind of extend towards the family network because of the way that relationships are kind of harmed during the process of addiction. And so the family reintegration component ends up kind of taking front and center for women who are reentering from institutional correctional settings. And that, to me, has been kind of one of the, as I've asked women about their labor market participation and kind of what their goals are during their reentry process, one of the things that has interfered most has been kind of focus on recovery, focus on family relationships, which has meant that individuals will often put kind of searching for work as something that they put on the back burner before they even start, which ends up being a larger issue for women who are under other supervision after carceral control. So once they're like in community supervision, that ends up also interfering with their ability to meet the requirements of probation and parole, because of the fact that that finding and actively searching for work is an important element of that. So I think in a roundabout answer to your question, all of these things, kind of the caretaking of children, the reintegration with family, recovery, and the requirements of probation and parole and finding work, kind of all conflict and make it for a very difficult process of reentry in that setting. So women who are able to successfully find work most likely don't have children, most likely are able to access resources from family that allow them to search for work effectively, which kind of doubly exacerbates the likelihood of finding work for individuals with low socioeconomic status and a lack of family support. I hope that answers your question. That's, I think, kind of where my research has kind of brought me.
Great. Thank you so much. And maybe we'll, I think, Anna, was there a question there for you somewhere? Or did you have any response to Sheena's question?
No, very clever. And Sheena, thanks for reminding me about something that does give me a tiny little bit of hope. Juvenile justice is one of those areas where a lot of progress has been made in Utah. There's still a long way to go, but it shows that big changes in policy can have substantial impact on different people in the community. So nice work on that.
Great. Lovely. Well, I think unfortunately we're out of time. I wish we were in person so we could all kind of continue the conversation. I'm sure there's lots of questions in the audience, but I want to respect all of our time and thank our panelists so much for this really rich conversation. So thank you to everyone on behalf of the Women in Economics Club and the Department of Economics. We're so thankful to have you. And please feel free, if there's any questions, folks are welcome to reach out